The drug class for this video are fluoroquinolones. All fluoroquinolones end in fluoxetine. These include ciprofloxacin, levofloxacin, allfloxacin, moxifloxacin, gemafloxacin, and delafloxacin. Fluoroquinolones act by inhibiting two bacterial enzymes, DNA gyrase and topoisomerase 4. This prevents DNA supercoiling and replication. This interference helps prevent cell replication and leads to the death of the bacteria. Fluoroquinolones are used to treat a wide variety of infections. These include respiratory infections, urinary tract infections, GI tract, bones, joints, skin, and soft tissue infections. Ciprofloxacin can also be used post-exposure to prevent anthrax, so it can be prescribed to patients who have inhaled anthrax spores. Fluoroquinolones are rapidly bactericidal and broad spectrum. They are best absorbed in the upper GI tract, although they can be given orally or IV. Fluoroquinolones, they're distributed in urine, stool, bile, saliva, prostate tissue, and bone tissue. They're metabolized in the liver and excreted through the kidneys. For precautions, there are many different resistant strains emerging, so blood cultures need to be taken before prescribing fluoroquinolones. Fluoroquinolones should also be cautioned when prescribing to children. Levofloxacin and ciprofloxacin are the only two fluoroquinolones that are approved for use in children, and they should only be prescribed after other antibiotics have been prescribed before and they didn't work. Like I said, for contraindications, children are a major contraindication, pregnant and lactating women, and patients with a history of myasthenia gravis. For adverse reactions, fluoroquinolones have a lot of mild adverse reactions. These include GI reactions such as nausea, vomiting, abdominal pain, diarrhea, some neurological effects. Confusion can happen. Older adults are more susceptible to the neurological effects and should be monitored a little more closely. Yeast infections can happen in the vagina and the pharynx. And then also seizures can occur, although they are very rare. And fluoroquinolones have a black box warning for tendon injury and phototoxicity. So phototoxicity and tendon injury are your two main adverse reactions, and they should be monitored for closely, and fluoroquinolones should be stopped at the first signs of either. For drug interactions, compounds containing cations are contraindicated in fluoroquinolones. These include aluminum or magnesium containing antacids, iron salts, zinc salts, calcium supplements, and then milk or other dairy products. Fluoroquinolones can increase the plasma levels of several drugs. These include theophylline, warfarin, and tinidazole. Toxicity could result if not monitored accordingly. Indications: fluoroquinolones are used for treating infections caused by gram-negative bacteria. Fluoroquinolones, they are only effective against gram-negatives and aerobes. They are not effective against anaerobes. The only fluoroquinolone that is effective against anaerobes is moxifloxacin. So that's one reason blood cultures are so important, so we know exactly what bacteria we're dealing with and whether or not fluoroquinolones are the right medication to prescribe. There's no monitoring recommended for fluoroquinolones. For education, patients can take fluoroquinolones with food to help decrease GI effects, and then also patients need to be educated on signs and symptoms of tendon injury. And they should be instructed to stop fluoroquinolones at the first sign of tendon injury or phototoxicity. Our main takeaways for this is fluoroquinolones should not be prescribed to children. Like I said earlier, ciprofloxacin and levofloxacin are the only fluoroquinolones to be prescribed to children, and that is only after other antibiotics have been tried. Also, for patients with a history of myasthenia gravis, fluoroquinolones exacerbate muscle weakness in these patients and should not be given to these patients with a history of this. And then, like I said, for the black box warning, tendon injury and phototoxicity, patients should be instructed to stop fluoroquinolone use at the first sign of either. And that's fluoroquinolones. Thank you.